Hi friends, morning. I'm Dr. Ashutosh Gupta and I'm a consultant fetal medicine. What I intend to do is this that probably we'll talk about NIPT. Okay, so this is a new technique and but probably we'll do it in series. So meaning thereby that today we shall talk about the NIPT and then the basic and then the nuances of the NIPT. Right. So once we do a NIPT, what all things that probably we should look around for and how the different small things they can really make a big difference as far as this interpretation and the report of the NIPT is concerned, right? And then we'll talk about in the case two, in the case series, we'll talk about twins, and then we'll take some cases. As a matter of fact, both for trisomy 18 as well as in trisomy 21 in the third series. बहुत स्मॉल फ्रेगमेंट्स होते हैं बेबी के जो डीएनए जो पास होके प्लेसेंटा से पास होके माँ के ब्लड में आ जाता है इफ इट इज 8% प्लस फीटल फ्रैक्शन वी आइडेंटिफाई टू बी ऑप्टिमल राइट इट यूजुअली हैपेंस फ्रॉम 10 to 12 वीक्स उसके बाद में सी एफ डीएनए कंसंट्रेशन गिर जाती है राइट एंड लेस देन 4% वो सब ऑप्टिमल हो जाता है उसको इवेलुएट करना थोड़ा सा मुश्किल हो जाता है ठीक है एंड देन द जीनोटाइप ऑफ द प्लेसेंटा एंड ऑफ द फीटस दे माइट वेरी राइट मीनिंग देयर बाय कि अगर आप इसको ध्यान से देखें तो वी कैन आइडेंटिफाई कि दोनों एक जैसे ही है प्लेसेंटा डिफरेंट हो सकता है फीटस से फीटस डिफरेंट हो सकता है प्लेसेंटा से एंड देन वी कैन हैव ए मोजाइक वेराइटी ओके सो ऑल दीज थिंग्स ये जो 9 वेराइटी है ये एनआईपीटी में रिफ्लेक्ट होती है if it is less than 4% fetal fraction we call it is a no call राइट इस नो कॉल के अंदर दोबारा रिपीट करने की कोई बहुत एडवांटेज होती नहीं है और एमनियोसेंटेसिस से हम एक इन्वेजिव टेक्निक है उससे हम बेबी के डीएनए के बारे में ज्यादा अच्छे से जान जान सकते हैं और जान पाते हैं ये स्लाइड को दोबारा से देखिए तो ए और बी में दोनों एक एक जैसे ही हैं राइट ओके सो द जीनोटाइप ऑफ बोथ द प्लेसेंटा एंड द फीटस दे आर सेम सी एंड डी कैन बी फॉल्स पॉजिटिव राइट एंड इवन ई को भी देखिए तो ये फॉल्स नेगेटिव भी हो सकता है मीनिंग देयर बाय कि बेबी बिल्कुल एबनॉर्मल है और एनआईपीटी नॉर्मल आ रहा है इसको भी ध्यान से देखिए तो ये अगर दोनों बराबर है 47% तो हाई रिस्क होता है अगर 46-47 है तो लो रिस्क आता है और रिवर्स में राउंड ये परसेंटेज ऑफ सेल्स रिलीज फ्रॉम द प्लेसेंटा अगर एबनॉर्मल है तो एनआईपीटी वेरी कर सकती है राइट तो मेरे कहने का मतलब ये है कि जो सी एफ डी एन ए है उसको कन्फाइंड प्लेसेंटल मोजेसिज्म का भी एलिमेंट बोलते हैं इसका मतलब ये है कि जो डीएनए जीनोटाइप है प्लेसेंटा का दैट माइट बी डिफरेंट फ्रॉम दैट ऑफ द फीटस ठीक है डूइंग एन एमनियोसेंटेसिस मेक्स मोर सेंस एज कंपेयर टू डूइंग अ सीवीएस so NIPT is a technique in which we try to evaluate the DNA which is there from the placenta that is circulating into the mother's blood. So there are few things to ponder. There are few things to look around for. The genotype and the genetic material or genetic makeup of the placenta might not be same that of the fetus. पहला, दूसरा, the amount of the DNA which is available into the mother's blood that we call as the fetal fraction, it is directly proportional to the fetal size. So fetal size we've identified or the placental size that we've identified is smaller in cases with trisomy 18 and 13, right? And third thing is this that there could be some element of a discordance between the genetic makeup of the placenta and that of the fetus that we call as a confined placental mosaicism. So all these things are more common with the fetus which is suffering from trisomy 18 or 13. So meaning thereby that there are more chances of something around 1 to 2% of landing up with a false positive sort of an NIPT, meaning thereby that the NIPT might show that it is suffering from a trisomy 13 and 18 and eventually the fetus is normal because of all these conditions, right? Second thing is this that this NIPT might not be the actual picture. This would not might not show the actual picture what the baby is having or if what the baby is suffering from. So we can have a mosaicism and into the fetus, which might not get reflected onto the placenta and therefore in the NIPT. So there are two slides in which I have very well shown that this mosaicism or can happen in both in the fetus as well as in the placenta. So similarly, the percentage of cells, right? The percentage of cells which has been sort of an which are being giving up their DNA into the mother's blood. अगर वो abnormal है so it can even lead to false positive अगर वो कम है तो false negative भी आ सकती है right So we need to take all these things into account. And fetal fraction, if it is greater than 8%, then it is very well identified to be a optimal fetal fraction so as to evaluate the fetus. And but if it is less than 4%, then we call it as a no call. No call meaning thereby that the placenta is not releasing, or then there is the fetal fraction available into the mother's blood so as to evaluate the DNA is not is suboptimal, and therefore it is a no call. In those no call conditions, ideally invasive test and preferably an amniocentesis should be done. Now, amniocentesis bypasses the placenta, and therefore that element of a CPM and a confined placental mosaicism and any mosaicism happening in the placenta gets away, right? And then we are directly reaching to the fetus, and then we are having and we are testing the actual fetal DNA, which is there from the skin fibroblasts, right? So all the element of those confined placental mosaicisms is get out of the way. So meaning thereby that amniocentesis is definitely a better test as compared to coronary pillar sampling or a CVS. CVS primarily is being done only when we want to do a molecular test, like we want to do for a Duchenne muscular dystrophy, or we want to do a spinal muscular atrophy, or we want to do it in a prenatal diagnosis of a thalassemia, and so on and so forth, right? So for all practical purposes, in something around 98-99% of the cases, this NIPT works wonderfully well. But in 2% of the cases, there might be some sort of an ambiguity, and therefore the NIPT might not reflect the actual picture which the baby is being suffering from. NIPT works wonderfully well in almost 99% of the cases and almost in trisomy 21, but remaining all the other chromosomes apart from 21, it is not that good test how it is being marketed. So probably we should take it with a pinch of salt. And specifically for other chromosomes apart from this 21, specifically for 13 and 18, this might be even false positive, right? So we should be mindful whenever we are interpreting those reports of the NIPT, right? So that is how it is, right? Thank you very much for your patient listening.